Hi, my name is Olivia and I'm here at Balcones Dermatology and Aesthetics with Miss Ileana. Today we will be doing a teen facial. This will help address any acne as well as give an opportunity for me to answer any questions she has about facial products in general or treatments that she can use at home. Are you ready?
Yes.
Yes? Okay, perfect. So as you can see, we have Ileana all ready for her facial. We're steaming the face. She may be wondering what exactly is going on since this is her first facial. So I just like to talk all of my teen patients through it, that the steam is going to help soften the follicle, also soften the skin, help prepare it for penetration of any active ingredients. So I steam the skin before I exfoliate and also while I cleanse the skin. Today I am choosing a skin clarifying acne cleanser. This contains salicylic acid, so it will help dissolve any sebum within the follicle itself. It will help address any of potential breakouts that may be underneath the surface. So I get a good lather up and I apply first. With my acne patients, it's also a good opportunity to address any questions that they have concerning what they use at home or what they could be using at home to help with any acne breakouts. Do you have any questions for me, Ileana?
Are there any good products that I can use at home?
Perfect question. There are plenty of products you could use at home for teens. The biggest concern is acne. So products that contain salicylic acid would be good for acne, as well as benzoyl peroxide. Sometimes a very light retinol can help with acne, preventing acne formation as well. Now with moist towelettes, I'm going to begin to remove the product. I use microfiber towels as they are not scratchy. They don't distress the skin, cause any unnecessary rubbing. Just very soft, and they're going to remove the last traces of that cleanser from the skin. For the exfoliation portion of the teen facial, I do use a closed loop microdermabrasion system. This is our Silkpeel Dermalinfusion. So what's going on is this tiny little tip does have a grit to it, and I can adjust the grit depending on the patient's needs. So for a first-time patient such as herself or a teen facial, I tend to go with a finer grit, so we're not really coarsely scrubbing the skin or anything like that. We're just exfoliating to help prevent future breakouts. At the same time, the skin is pulled into the suction system so that we are actually infusing the skin with a condition-specific serum at the site and time of exfoliation. You can see this is the pore clarifying solution, so this contains salicylic acid to help prevent any future breakouts. It sounds like a dentist, huh? It's not going to hurt. It feels maybe a little bit like a cat licking your face. You doing okay, Ileana?
Yes.
Does it feel a little bit like a cat licking your face?
Yes.
Yeah. I know you like animals. So as you can see, we are extracting any dead skin cells, sebum, impactions from the skin itself. It travels along these clear tubes. And you can see it is filling up our reservoir right here with a lovely solution of dead skin cells, sebum, blackheads, that sort of thing. So you can actually take it off at the end and see them all floating around in there. Go.
What's the light for?
That's so I can see you better. So I'm actually going to perform extractions. Go ahead and close your eyes for me. Using a very gentle technique, since this is usually their first time coming in, if not a few times in, I'm not going to aggressively squeeze the skin. I'm just going to kind of see if I can rock and wiggle out any impactions. Kind of help relieve some of the pressure in the follicles themselves. You can see that I'm not applying a lot of pressure to the skin. I don't want to. Her skin is pretty tender, it's still young. I'm not going to cause any unnecessary tugging or pulling or pain. I'm just kind of rocking the skin, relieving any pressure or impaction from the follicles themselves.
Can I do this at home?
It's recommended not to, because you usually can cause scarring at home. The skin has not been prepped properly, and usually the technique is not as gentle as this. Most people get in front of the mirror and they squeeze as hard as they can, and they go way too long at the skin. So since I have properly steamed and exfoliated the skin, it's safe for me to do in a very gentle way. As you can see, it's a general, very gentle rocking motion that I use for the teen patients. So Ileana, this is what we extracted out of your face. How does that look to you?
That's not what I expected.
Not what you expected. A little gross, right?
Yes.
Well, it's good that it's out. So was it better than you expected? How'd you like your facial?
My face actually feels, my skin actually feels healthier.
Healthier? Yeah, a little smoother.
Yeah.
Didn't hurt, did it?
No.
No. Okay. Well, if you're interested in booking a teen facial for your child or someone you know or yourself, go ahead and give us a call here at Balcones Dermatology and Aesthetics so we can go ahead and take care of you. Bye.
Bye.